Welcome to the London College of Animal Osteopathy podcast. In our canine series, we discuss canine osteopathy and welfare. We offer courses in canine osteopathy and canine science. To find out more, go to animalosteopathycollege.com. Today we're talking about biopsychosocial health in dogs. When we look at the health of a patient as an osteopath, there is more to it than just assessing the animal for musculoskeletal problems. Osteopathy has always been a system that considers all of the possible external and internal factors that impact health states. All patients in osteopathy are seen as a triune of mind, body and spirit, as said by Andrew Taylor Still, the founder of osteopathy. The spirit aspect has much been forgotten in modern osteopathy, particularly in the human realm, but it still plays an equal part in health and well-being. Dogs are very intuitive and emotional creatures. This is something we love about our four-legged companions, but it's also a possible reason for disturbances in their health and their well-being. We've all probably experienced what it's like to feel like we're getting sick after a particularly stressful week at work, or to get aches and pains following an emotional event such as a funeral. These reactions are completely normal, and as a result of the interdependent relationship between our mind and bodies. Dogs are very susceptible to emotional change due to their extremely well-developed empathy and attunement to body language. Dogs evolved close familial bonds and emotional intelligence as an effective survival mechanism, and this has made the domestication of dogs so successful and rewarding for both animal and human. The problem with any sort of sensitivity is the possibility for something to create a negative outcome via this perceptive pathway. Let us consider a hypothetical case. A dog and owner have come to see you as their osteopath, and the owner explains that their dog, a 3-year-old Labrador male, has been walking wide behind, and their hindquarters seem to stray to the left, instead of tracking neatly in line with the front feet. Perhaps the most noticeable sign you see as the dog enters your clinic is that they're clearly very nervous and display a typical fear posture when greeting you. It's then important to consider what the dog's posture is like when they're at home or anywhere else. We would question the owner as to the dog's usual behaviours and what their interactions are like with people and other animals. Through the case history, we discover that the dog is a rescue and had a very troubled and abusive past before the owners that have him now. The owner says how he's a very nervy and frightened dog and often shows the posture we see in the clinic. On physical examination, the dog displays reduced range of motion in spinal extension in the lumbar region, that's the lower back, reduced hip extension, left more than right, and sensitivity just above the stifle joint, that's the knee joint. If we take a look at the picture above of fear posture and imagine being in that position consistently, then we can certainly see why the areas of the body would try to accommodate the posture and alter their structure, and as a result of that, their function. The lowering of the hind end increases the flexion of the hip and the stifle joints. The hip flexors will shorten and neurologically, let's say, retune to maintain that position with less physical effort. The highly tendinous tissue of the quadricep muscles, located just above the stifle joint, will be on stretch all the time. Well, all the time they're in that posture, and therefore become more reactive to touch. The spinal region is really complex. The fearful flexion of the spine that this dog is presenting then will alter all of the spine's other ranges and movements. A renowned osteopath, Harrison Fryette, explains that his 3 spinal laws, flexion of the spine, will alter the available range in other planes of movement. The dog may well have to rotate and side bend the spine, resulting in the non-tracking hind end due to the regular flexion and resultant tension of the spine, the flexors and the abdominal muscles. So we begin to see the trail of clues leading us back down the pathway of these symptoms, and we come to a hypothesis that the dog's emotional state has certainly a large part to play in the posture and possible resulting discomfort that they feel. Although this is just a hypothetical case, it's easy to see the basic principles of the biopsychosocial approach to health. This is one of the many things that make osteopathy such a fascinating and rewarding career. It's like being a holistic detective and seeking the clues to your hypothesis. Obviously, unless you're a qualified behaviourist, this case would also need referral to behaviour specialists to resolve the root cause of this particular problem. As long as the behaviour is not dangerous, and you've risk assessed that the animal is safe to treat, then the osteopathic treatment can still take place. In fact, the resolution of physical manifestations will in turn impact the emotional state of the animal. We know that one part of the triune can not exist and function without the other, and so while we're not treating behaviourally, we will undoubtedly have effect on the mind and its state by interacting with the physical state. To find out more about what you can learn about animal behaviour and how osteopathy can help dogs, horses, and all sorts of other animals, go to our website at animalosteopathycollege.com.